Now, part 21 of emergencies in first aid, and to talk about dislocation. A dislocation is when the joint is pulled out of its normal position. There is tearing of the ligament and capsule. A ligament is what gets to hold a bone to another bone like that. Dislocations can occur with or without a fracture. Common sites of dislocations are the shoulder joint, the thumb, fingers, and also the lower jaw. What are the signs and symptoms that there's a dislocation? There's going to be deformity. In most joints, there is obvious deformity. You'll know that there is actually a dislocation here. There's also going to be severe nauseating pain, the pain that almost wants to make you feel as though you are vomiting. So severe. Also, complete loss of function and normal movement of that joint. Okay, complete loss of function and normal movement. There's also going to be swelling and bruising. How do you get to treat that? So treatment, the limb or joint should be supported securely to avoid unnecessary movements. A cold compress, so we're going to compress that part that has been dislocated, okay, so that you reduce the swelling and also reduce pain, all right? And then you are supposed to take the victim to the hospital. Never try and reduce the dislocation. You don't want to take back the bone into its point. Your aim is just to make sure that you relieve some pain like that by compressing that point. Okay, but not try to put back the dislocation to normal. Okay, so that is basically it. That is basically it on this part on dislocations. Make sure that if someone you've seen is dislocated, what you want to help them is to support them so that they avoid unnecessary movements, and also you make sure that you compress that part with, you can even put something cold, cover something cold so that the pain can be reduced. So that is it for this part. In the next part, we talk about burns and scars.